Hello, everyone, and welcome to today's webinar. My name is Ojasvi Kaul, and I am a clinically trained psychologist working at JIPS Hospital and the Addiction Center. Today, here in the webinar, we will be talking about what it is like to deal with a mental health diagnosis. Let's get started by diving deeper into the topic of mental health diagnosis and why it's important for all of us. When we talk about mental health, we are talking about a wide spectrum of thoughts, feelings, and behaviors that shape how we experience life every day. Mental health issues can affect anyone, regardless of age, background, or lifestyle. And yet, many of us don't realize how common it is until it becomes a personal matter. One of the most difficult parts of dealing with mental health is the uncertainty that comes with it. You might start off feeling like, you know, feeling off for no clear reason. You could be wondering, why am I feeling like this? What's going on with me? It's a question many people ask themselves, and the journey to finding that answer can be filled with frustration, confusion, and even fear. Receiving a mental health diagnosis can often feel like the moment where you finally get some clarity. But at the same time, it can open up new set of questions such as what does this mean for me, or how will it change my life? It's not just a label, it's the first step in understanding what's been happening beneath the surface and how you can start taking control of it. What makes a mental health diagnosis especially relevant is that it helps put a name to the challenges you have been facing. It's like piecing together a puzzle that explains why you have been feeling the way you have, whether it's persistent sadness, overwhelming anxiety, or confusing mood swings. Once you have that name, you have a path forward. It helps you and your mental health professional understand what steps to take next, whether that's therapy, medication, lifestyle changes, or simply learning new ways to manage stress. So, as we go through today's session, I encourage you to keep in mind that this process, although it might feel overwhelming at times, is also a powerful opportunity to take ownership of your own mental well being. Just like a physical health diagnosis helps you take action towards recovery, a mental health diagnosis is a stepping stone towards feeling better and living a more balanced life. And that's why we are here today to explore not just the technical side of the diagnosis, but also the emotional journey that comes with it and how you navigate it successfully. Now, let's take a closer look at what a mental health diagnosis really means beyond just the label. When we think of health, we often focus on the physical side, things like a fever, a sprained ankle, or high blood pressure. But just like our bodies, our minds can also face challenges that affect how we think, feel, or behave. A mental health diagnosis is simply the process of identifying those challenges, giving it a name, and understanding how to approach them. The key idea here is that a mental health diagnosis is mostly about patterns in how we think, feel, or act over time. Imagine you've been feeling really low for weeks, not finding joy in things you once loved, or struggling to get out of bed. These aren't just fleeting feelings, they're signals or symptoms that something deeper might be going on. A mental health professional looks at these patterns and uses them to understand what condition might be at play. Just like a doctor might use a cough, a fever, and shortness of breath to diagnose a flu. For example, you might be diagnosed with depression if you have been experiencing ongoing sadness, a loss of interest in activities, physical symptoms like fatigue or sleep problems, or perhaps anxiety. If you have been feeling a constant sense of worry, racing thoughts, or even physical symptoms like a tight chest or restlessness that might make it hard to concentrate or relax. These conditions are incredibly common, affecting millions of people. But without a diagnosis, it's hard to know what's happening or how to address it. So, what exactly does a diagnosis do? Well, it helps us in two big ways. Understanding the problem. A diagnosis is like a roadmap. It tells you what's happening in your mind and why you might be feeling the way you do. Without a name for what you're going through, it can feel like you're lost in a fog, not sure what's wrong or how to make it better. A diagnosis clears that up. It gives you clarity and a way to move forward. And the second is guiding treatment. Once you know what's going on, a diagnosis helps guide the next steps. For instance, with depression, a mental health professional might suggest therapy, medication, or lifestyle changes to help rebalance the chemicals in the brain that regulate your mood. For anxiety, they might recommend relaxation techniques or exercises to help manage your thoughts. Think of it as having a personalized plan that targets what you're going through rather than taking random steps that might not get you anywhere. Two of the key terms that we should discuss are symptoms and diagnosis. Symptoms, these are the clues that something might be off. Think of them like red flags, whether it's feeling persistently sad, anxious, or unusually fatigued. These signs tell the professional what areas to focus on. The second is diagnosis itself. This is the name you give to the pattern of symptoms. It helps you and your health provider understand what you are dealing with and what the best strategies for treatment are. It's like giving the issue a proper identity so you can deal with it more effectively. Now, when you hear a diagnosis like depression, bipolar disorder, or anxiety, it can be overwhelming at first. But think of it like this, it's not just a label, it's a start of understanding what's been going on inside you. And more importantly, it's beginning of figuring out how to manage it. Just like cold, diabetes, or high blood pressure that can be managed with the right steps, so can mental health conditions. It's not the end of the road, it's the beginning of a journey towards feeling better. Mental health diagnoses are also often misunderstood. Some people worry that it's a way of putting people into boxes or defining them by their condition. In reality, a diagnosis is not as much about labeling someone as it is about creating a pathway for healing. It's a tool, not a definition of who you are. It helps your mental health provider offer treatments tailored to your needs, and it helps you make sense of your experiences. Now that we have covered what a diagnosis is and how it works, let's explore how it feels like to receive one. Just like getting news about a physical health condition, being told you have a mental health diagnosis can trigger a wave of emotions. By focusing on these details, we are making sure that the idea of a mental health diagnosis doesn't feel clinical or distant. It's something that can help you regain control and move forward in a meaningful way. Let's talk about that. After receiving a mental health diagnosis, people often experience a flood of emotions. It's not just about the diagnosis itself, it's about what it means for your life, for your sense of self, and the future you imagined. Let's dive deeper into some of these common emotional responses, okay? One by one. Let's start with shock. One of the first reactions many people experience is shock. You might hear the diagnosis and feel disconnected from it, thinking, is this really happening? Or could this really be true? Even though you have probably been dealing with the symptoms for a while, having someone give it a name can feel surreal. It's almost as if your brain needs time to catch up with the new reality. It's completely natural to feel a bit numb or frozen in the moment, as your mind takes time to absorb the information. In this phase, you might not know how to respond, and that's okay. You're processing it. Next up, people tend to feel fear. As the shock begins to fade, it's common for fear to settle in. Fear of the unknown can be overwhelming. And you might start asking yourself questions like, what does this mean for my future? Will I always be like this? Or even, how will other people see me? This uncertainty can make you feel like you have lost control, which can truly be a very unsettling experience. Humans are wired to fear the unknown, especially when it involves something as personal as our mental health. It's important to recognize this fear and understand it's a natural part of the process. On the flip side, many people feel this unexpected sense of relief when they receive a diagnosis. You might have been struggling with confusing, frustrating, or even distressing emotions and behaviors for a long time. Finally, hearing that there's a reason for what you've been going through can lift a huge weight off your shoulders. It can feel like, at least now, I know what this is, and there's something I can do about it. The mystery is gone, and now you have a starting point to address the issue. This relief doesn't mean that you're happy about the diagnosis itself, but it can bring a sense of closure to the confusion you may be feeling before. For other people, anger bubbles up to the surface. You might think, why me? Why didn't anyone catch this sooner? Or even, why did this have to happen right now when I've been going through so much already? Anger is a perfectly normal reaction to any situation where you feel helpless or like things are unfair. You might feel angry at yourself for not noticing the symptoms earlier, or you might direct your anger towards others, family members, doctors, or even the world in general. What's important to remember here is that anger is a valid emotion, and it's also something that can be worked through. Less talked about, but a very real reaction is grief. When you receive a diagnosis, there's often a sense of loss that comes with it. Loss of the life you thought you might have, the person you thought you were, or the future you envision for yourself. This doesn't mean that everything is going to be negative moving forward, but it's okay to mourn the idea that things might look different from what you had expected. This form of grief isn't about physical loss, but more about letting things go of the certain expectations that you may have had. And just like any form of grief, it's something that takes time to process. Well, another common emotional response is confusion. Even though a diagnosis is meant to bring clarity, it can also leave you with more questions than answers. You might wonder what this diagnosis really means for your daily life, or how exactly does it fit into your personal identity. The idea of mental health might feel abstract or unfamiliar, making it hard to fully grasp what's going on. It's crucial during this time to practice self compassion. The emotions you feel, whether they are shock, fear, relief, anger, or all of the above, they are valid. Give yourself permission to feel whatever comes up without judgment. Everyone processes news like this differently, and there's no right way to react. What matters most is acknowledging your emotions and giving yourself the space to sit with it. This is where many people actually begin their journey. Emotions are by nature messy, layered, and sometimes overwhelming, but they are also an important step towards healing. You might move through these feelings knowing that it's just okay. It's okay to take your time. Just like any life changing news, this diagnosis is something you will continue to process over time. As you begin to recognize and understand your emotions, one of the most helpful things you can do is simply make space for them instead of pushing them away or trying to fix them right away. Give yourself permission to feel what you're feeling. It's okay to have moments of doubt, frustration, or even sadness. Let yourself feel those emotions. without pressure to move on too quickly. In fact, acknowledging and accepting these emotions can be a very powerful first step towards healing. Each emotional reaction is a stepping stone in understanding your diagnosis and what it means for you personally. Whether you're feeling shock, fear, relief, anger, remember that these emotions are part of the process. And now that you have identified what emotions may rise, let's move into some strategies that might help you cope with these feelings and move forward in a positive, constructive way. Now that we have talked about emotional reactions, let's focus on the most important question: what comes next? After receiving a diagnosis, it's normal to feel unsure about the future, but there are steps you can take to regain control of your life. This is where the journey of understanding, acceptance, and action begins. Let's explore how you can move forward in a positive, proactive way. One of the most empowering things that you can do is educate yourself about what you have been diagnosed with. When we are uncertain about something, it tends to feel a lot more intimidating. The more you learn about your mental health condition, the less power it holds over you. Suddenly, it's not this mysterious, overwhelming force. It's something you can understand, navigate, and manage. Take the time to talk with your doctor or therapist. Read credible sources. And don't be afraid to ask questions, no matter how small or complex. When you understand what's happening in your mind and body, you're far more better equipped to handle it. Knowledge truly is power. For example, let's say you have been diagnosed with anxiety. Initially, it might feel like anxiety is controlling every aspect of your life. But as you learn more about how your body reacts to stress, you start to see the patterns: the racing heart, the sweaty palms, the tension. Those are your body's natural responses to what it perceives as a threat. Once you recognize these responses for what they are, they become less frightening and you begin to see ways to manage them. Techniques like deep breathing, grounding exercises, or mindfulness can suddenly become tools that help you navigate through these really anxious moments. After a diagnosis, it's natural to feel like you're going through it alone. You know, but you don't have to. Surrounding yourself with a support system is very crucial. This could be your family, close friends, or even support groups where people share a similar experience. Sometimes just talking about what you're going through can lighten the emotional load a lot. However, it's important to acknowledge that not everyone in your life may understand what you're going through right away. Mental health isn't always an easy topic to discuss, and people's reaction may vary. Be patient, both with the other people around you and with yourself, as they come to understand your diagnosis. The key is to find people who listen without judgment and are there when you really need them. For example, imagine you have a friend or a family member who doesn't quite get it at first. They might say things like, "You don't really seem sick," or just snap out of it. I'm sure we have heard a lot of these already. While that can be frustrating, remember that mental health is often invisible and not everyone understands it right away. Keep communicating openly, and over time, they may come to understand it more. In the meantime, finding even one person who listens can make all the difference. Seeking therapy is one of the most effective ways to move forward. Therapy provides a safe space to talk openly about your thoughts, feelings, and behaviors with someone who's trained to help you understand and manage them. It's not just about talking through your problems, as most people think. It's about gaining insight into your patterns and learning practical tools to cope with them. For most people, therapy can be life changing. It offers both emotional support and concrete strategies to help you navigate the difficult moments. Different forms of therapy, like Cognitive behavioral therapy or CBT can help you challenge negative thinking patterns, while other approaches might focus on mindfulness or improving relationships. The key is to find what works best for you. Now, when a mental health professional, a psychiatrist, a psychologist, or someone else in the field suggests a treatment plan, it's important to follow it as closely as possible. This might include a combination of therapy, medication, lifestyle changes, or self care strategies. It's easy to be overwhelmed by the idea of treatment at first, but think of it as your personalized roadmap to feeling better. Just like you would follow a doctor's prescription for physical health, following your mental health treatment is key to improving your well being. This isn't always easy, trust me, I get it. There might be days when it feels like nothing is working, but consistency is crucial. Stick to the plan, and over time, you'll start to see the benefits. In cases where you feel that it's not working, communicating with your health provider is very important. Talking about what does not seem to be working for a long time and areas where you seem to have shown a little bit of improvement helps the provider as well to give you more better strategies to improve as you go further. In some cases, the medication might be recommended to help manage symptoms. Mental health conditions like depression or anxiety often involve imbalances in the brain's chemicals. Medication can help restore balance, making it easier to manage your emotions and thoughts. It's important to remember that the medication doesn't change who you are. It's simply a tool to help you feel more like yourself. Some people worry about the stigma surrounding medication, but there's no shame in using it if it helps you. Just like you take medication for diabetes or a heart condition, taking medication for your mental health is about caring for yourself in the best way possible. Receiving a mental health diagnosis can feel like a setback, but it's crucial to be kind to yourself during this time. You wouldn't judge a friend harshly for going through a difficult time. So why do it to yourself? This isn't something you chose, and it's not something you can simply get over. Instead, focusing on small steps forward each day and acknowledging your process and progress, no matter how small it may seem. Recovery is a journey, not a sprint. Lastly, it's incredibly helpful to have a coping plan in place for the tough days. We all have them, and they're a normal part of life, especially when dealing with a mental health condition. A coping plan is like a toolkit filled with activities or strategies that help you feel better when things get tough. Whether it's taking a walk, calling a friend, practicing mindfulness, or even just taking a few deep breaths. Having a go to list of things that make you feel grounded can be a lifesaver. It's about knowing what works best for you and being ready to use those tools when you really need them. Imagine you are having a particularly difficult day. Everything feels overwhelming, and you can't seem to shake the negative thoughts. Having a coping plan might involve stepping away from the situation, taking a few deep breaths, and going for a short walk outside. Maybe it's listening to your favorite song or journaling your thoughts. These small actions can have a big impact in helping you regain your balance. Moving forward after mental health diagnosis doesn't mean everything is suddenly easy, but it does mean you now have the tools and the understanding to take control of your life. It's about learning to manage your emotions, educating yourself, building a support system, and sticking to your treatment plan. Each step forward is progress, and with time, acceptance, and action, you'll find your way to a better place. Take a deep breath. You have made it this far, and that's something to be proud of. Moving forward is all about learning, accepting, and taking small steps towards a healthier, more balanced life. To conclude, receiving a mental health diagnosis can be overwhelming, but it's a first step towards healing and understanding yourself better. It's natural to feel a range of emotions, from shock to relief, and there's no right way to go about it. With the right support, treatment, and compassion, you can manage your mental health and move forward. A diagnosis does not define you, it's just part of your story. Thank you for being here today, and remember, reaching out for help is a sign of strength, not weakness.